It's me, Miss Community Clovia. Thank you so much for joining me for another edition of Community Conversations. And here with me, I have some very special guests this morning. Mr. Terry Coffey, CEO of Virginia Urology. Good morning.
Good morning, Clovia.
Smile a little bit.
I'm smiling.
We have Dr. Nelson is joining us. He's a urologist with Virginia Urology. Good morning.
Good morning, Clovia.
And we also have Mr. Gary Ellis, who is a prostate cancer survivor. You want to say good morning?
Good morning, Clovia. How are you this morning?
We can hear your voice all the way over there. Your voice carries. All right, we're going to jump right in. What is prostate cancer?
Well, Clovia, prostate cancer is an uncontrolled growth of cells within the prostate. And the prostate is a male organ about the size of a walnut that sits about at the base of the bladder. And it is actually one of the most common causes of cancer in men. And is the second most common cause of cancer death in men. And 1 in 6 men will develop prostate cancer in their lifetime. So it's a very serious cancer. Fortunately, it's very curable.
What are some of the symptoms of PSA?
Actually, they're in the early stages, in the early treatable stages, there are no symptoms, which is very important for your listeners to understand, because I do a lot of community-based outreach, and I find that many men won't come to get checked because they say they feel fine. In fact, what they need to have is a blood test called a PSA and an exam, because it's not until the cancer is advanced that symptoms will manifest, such as frequent urination, getting up at night to urinate, blood in the urine, weak stream. Those are very late stage symptoms, and the cure potential is very limited.
So who should get a PSA test at this point, the age group?
The PSA screenings start for the general population beginning at age 50, and it goes to about 70, 75. Annual blood test, the PSA, which I'll go into a little more in a moment, and then what's called a DRE, or digital rectal exam. And you need to have both of those. It is critical. Now, those men that are at higher risk for prostate cancer, they need to have screening done a little earlier. Who are the high risk? African American men, men with strong family history of prostate cancer. Those men should be checked beginning at age 40 to age 45, because we find cancers occur in those patients at a lot earlier age.
Some of the late stages of prostate cancer is all due to men who say, I feel fine and I don't need a checkup.
Yes, that's a problem that we find, particularly in the African American community, is that men in general don't like to go to the doctor, and a lot of times they get pressured to come in to see the physician because of a loved one, a wife, a significant other, a mother who insists that they come in and get checked. So we do see advanced stages because patients don't come in until they have symptoms. So it's critical to get checked early, at an early stage. Critical
to get checked early. Do you have a website or any kind of
Yes, we do. It's www.uro.com. Is that right, Mr. Coffey?
Yes, it is.
uro.com. And I want to speak a little bit more when we talk about the screening. Who should be screened and what is involved? See, that's where it
yes,
sticky.
The screening before the screening process has advanced since the early to mid 1980s. Now we use what's called a PSA, which is a prostate-specific antigen. Essentially, what it is a protein that's released by the prostate itself, and the normal range across the board should be from 0 to 4.0. And younger men should have lower levels. Older men, as the prostate grows, makes more PSA, therefore they tend to have higher PSA levels. But the cutoff, the general cutoff, is about 4.0. However, if I should see a man who's in his 40s who has a PSA of 3.9, that's abnormal. So we don't use just generic cutoffs. We follow trends and age-specific levels. But just in general terms, the normal range is 0 to 4. And the PSA is critical, but you also need to follow it up with what's called the digital rectal exam. The prostate cancer occurs in the prostate near where it abuts the rectum. And it's important that your physician is comfortable and familiar with that anatomy and being able to feel any abnormalities. Because at least 10 to 20% of prostate cancers, patients will have normal PSAs but have an abnormal digital rectal exam. So you can't get by with just a blood test alone.
Wow. What are some of the treatment options for PCA?
The treatment options for prostate cancer vary, and from the top tier therapies have been surgery, surgical removal, and there are a variety of approaches, and there's also radiation, several approaches of that way. Then there's other therapies such as freezing the prostate called cryotherapy, and there's hormone therapy to slow down the growth of the cancer. And there are some patients, particularly elderly patients that have minimal disease, that we observe, something we call surveillance or active surveillance or watchful waiting. Well, we don't treat those patients because prostate cancer is a slow-growing disease.
Wow. Looking at these stats, prostate cancer is the most commonly diagnosed cancer in the U.S. today. Prostate cancer is the second leading cause of cancer death in men. So what you don't know can kill you, even if you feel good.
Absolutely. And nationwide, the death rate from prostate cancer is highest in the African American community.
Why? Do we know any particular reason why?
We don't have a good handle on this. It's been studied extensely, and we believe it definitely has something to do with genetics. We think dietary
some food.
Dietary intake plays a role, particularly high-fat diets. Obesity may play a role in it, but we really don't altogether know. We just know that African American men are at the highest risk.
And we're still doing research, of course. And we're going to talk about how all of our listeners can get involved. There's 99% 5-year survival rate if caught early.
That is correct.
Wow, this is wonderful. Gary?
Yes.
Gary was your patient,
Yes.
Dr. Robert Nelson. Come on, Gary.
Yes.
Yes, I was. Yes, I was.
Yeah. So let's talk about you. Gary Ellis, welcome to the show.
Thanks,
When were you
Clovia.
diagnosed with prostate cancer?
I was diagnosed in 2006. I think it was November of 2006, October or November of 2006.
Did you have any symptoms, or it was during your regular checkup?
No, it was during my regular checkup.
Wow,
I've been going to get, and that's what Dr. Nelson said is it is so very, very important that we go annually, especially when I turned 40. I decided at that point that I was going to go to the doctor every year and get my annual physical, and I've done so. My prostate cancer showed up in a PSA screening because the levels were high. So my primary care physician recommended that I go and have the DRE for that thing.
I know. Ouch, whatever.
So after all of that, we met with Dr. Nelson. My wife and I met with Dr. Nelson. We decided on surgery, and the type of procedure that I elected, Dr. Nelson is one of only, I think, 2 or 3 doctors that do it in the area. So we spoke.
So you were in the best care?
I was in the best care. And have suffered no ill effects. I told Dr. Nelson, going back, I've had, any number of surgeries, just minor surgeries, and I was in more discomfort after those than I was after this so-called major surgery.
Wow.
And the recovery period was uneventful. Everything went according to plan. Nothing has changed in my personal life. Let me reiterate that.
Yeah.
Nothing has
Hold
changed.
Hold that thought, because it's going to get better. And you're married. That's a good thing.
Yes.
We're going to take a break and come on back. It's Community Conversations. I'm Miss Community Club.